Hi Megan, my name's Alora. I'm your student nurse. How are you today?
Fine, thanks. How are you?
Good. So we're going to do an assessment today, but I just wanted to let you know before I came in here I washed my hands.
Okay.
Okay. So we're actually just going to start. How old are you?
I'm 22.
Okay. So you look your stated age, and now we're going to assess your level of consciousness. So we're going to do that using the Glasgow Coma Scale. So I can tell just right now through our small conversation that your eyes open spontaneously. So the next thing is your verbal response. So do you know where you are?
Yeah, I'm at CBU University.
Okay. Do you know the date?
It's November 8th.
Okay, awesome. So next we're going to look at your motor response. So I'm just going to see if you can move on command. So can you lift your left arm just above your head? Perfect. And your right arm? Okay, awesome. That's great. Thank you. Okay, so now we're going to look at your skin color. So I don't notice any cyanosis or pallor or jaundice. So that's good. Looks nice and even. And you're pure well nourished. I noticed when you walked in that your posture was upright and erect and your gait was smooth and comfortable. So I noticed no obvious physical deformities. Your grooming and hygiene is great. You look clean. There's no body odor, no breath odor. Um, your mobility seems good. I didn't notice any assistive devices. Do you have any?
Nope.
Nope. Okay, good. You don't appear to be in any distress or anything, so you're okay. Yeah. Your mood seems good. You seem appropriate for the situation. Based on our conversation, you're understandable, your pace is good, you're able to answer my questions, so your hearing is good, yes?
Yep.
Yep. Okay, Megan, now we're going to assess your skin. So I'm going to start by looking at your hands. Okay, so the color seems nice and uniform throughout. There's no noticeable redness or anything. There's no excessive moisture. They're nice and smooth. I'm just going to look at trigger and make sure there's no tenting. So yeah, you're good on that one. Perfect. So now we're going to look at your fingernails, okay? So we're just going to look at the shape and make sure there's no obvious clubbing or anything like that. And they're all nice and pink and smooth. So look at these ones. Okay. And they're all nice and pink and smooth as well. Yeah, so now we're going to check capillary refill. So we'll do it on each hand. So we'll start here. And that's nice and fast. That's back in under 2 seconds, so that's great. And that one's the same. All right, Megan, so now we're going to look at your head and your face. So we're just going to start with your scalp and your hair. All right, so I'm just going to palpate your hair, or palpate your head first, if that's okay.
Mm-hmm.
So I'm just going to give it a little feel. Don't notice any like bumps or lumps or anything. I'm just going to take a look in your hair, if that's okay. So I don't notice any infection or lesions or infestation, which is awesome. Just take a little check on the back. Okay, and your hair is nice and thick, it's silky, it's soft, it's definitely clean, so good job. Yeah, and as far as I can tell, your scalp and everything is nice and round, frontal, parietal, and all that's good. Now we're going to look at your face, okay? So based on what I see right now, it looks symmetric, there's nothing uneven about it or anything like that. Your palpable fissure, which is basically the distance that your eyes are open, there's no drooping or anything, so nothing's paralyzed, so that's good. Your nasolabial folds are basically your laugh lines, and when you smile, yeah, so they're nice and even, that's great. And your facial movements are symmetric in our conversation, so that's nice and obvious. Now, if it's okay with you, I'm just going to feel your temporal artery. Yep. Just step in here. Yep, and that's nice and strong, that's awesome. Okay, and then next we're going to do your temporomandibular joint, which is your TMJ. So I'm just going to put my hands here on your face and get you to open your mouth for me. Awesome. Now, I didn't notice any popping or clicking, did you?
Nope.
No? Okay, awesome. So now I'm going to do your sinuses. So we're going to do frontal first, which is just right up here. So I'm just going to feel here, and you let me know if there's any tenderness or anything. You good?
Yep.
Yep. Okay, and now maxillary. Anything?
Nope.
No? You're good? Okay, Megan, so now we're going to look at your eyes. So we're going to start with your visual fields. This is called confrontation. So we're going to start by giving you a cue card, and I'm going to get you to put it over your right eye. And I'm going to put mine over my left eye, and I'm going to take a step towards you. And basically what I'm going to do is move this object into our different areas of gaze, and then I'm going to get you to say when you see it. Okay? Okay. Yep. Awesome. So we're going to start with upward, and I'm going to come down.
Yeah.
Okay, good. And I'm going to go temporal, so you tell me when you can see it.
Yeah.
Okay. And we're going to go, we're going to come from the bottom up.
Yeah.
Okay, and then I'm just going to switch, and we're going to do nasal. Okay?
Yeah.
Okay, awesome. Perfect. And I saw them when you saw them, so that's great. Okay, Megan, now we're going to test your extraocular muscles. So we're going to start using the corneal light reflex. So basically I'm going to get you to stare straight ahead. I'm going to take this light, I'm going to shine it at your eyes. The idea is that the light should reflect in the same spot in both pupils. Okay, ready? And that was perfect. That's good. So now we're going to do the cover-uncover test. So I'm going to get you to stare at my nose. I'm going to give you this card and get you to cover one eye. So the idea is that the uncovered eye maintains a fixed gaze, and that the covered eye will also maintain a fixed gaze, which means that there's no muscle weakness. Okay? So I'm just going to get you to do that now. Okay, that's good. And take the card away. Awesome. Can I get you to just do it on the other eye?
Mm-hmm.
Okay. That's good. Take it away. Awesome. So there's no muscle weakness in either eye that I could notice. Thanks. Right, now we're going to test the 6 cardinal positions of gaze. So I'm going to get you to look at this Sharpie here and just follow it as I move it, okay?
Mm-hmm.
That is good, and I didn't notice any nystagmus while you were doing, and everything, it followed it nice and parallelly, so that's great. So now we're going to look at your external eye structure. So I'm just looking at your eyebrows right now. They look intact, they're evenly distributed, so that's great. And then we're looking at your eyelids. So the skin is intact, there's no discharge or discoloration that I can see. Your involuntary blinking is at a normal rate, so that's great. And there's no visible sclera above the cornea when the lids are open. And as far as your eyelashes go, they're evenly distributed, and they curl out and they look nice. Now we're going to do Perla, which basically is looking at pupil activity. So I'm just looking now, and your pupils are equal and round. So now I'm just going to see if they're reactive to light, okay? Perfect, and they constrict, which is great. So now I'm just going to get you to focus on my finger. And your eyes converged, as well as your pupils constricted, so that's perfect. Okay, Megan, now we're going to look at your external ear structure, okay? So from what I can see right now, they are both equal in size bilaterally, they're symmetrical, and they line up very nicely with your eyes, which is great. So now we're just going to look at the skin condition, if that's okay.
Mm-hmm.
So there's no evident swelling. Do you notice any tenderness or anything?
No.
No? Okay, there's no lesions or discharge on that one. And this one is also good. That's awesome. So while I'm over here, I'm just going to look at the auditory meatus and make sure the hole is nice and present so you can hear. It's good, and there's a little earwax, but that's completely normal. And the skin color lines up perfectly with your face. Okay, now I'm just going to continue examining your ears. So I'm just going to push on your tragus, okay, and you let me know if there's any tenderness. Feel anything?
No.
Okay, just check the other ear. There's no pain or anything? No? Okay. We're just going to check pin or recoil, okay? So it's good. On this side. It's awesome. Okay, so that's good. So now we're going to move on to your hearing. So we're just going to do a whispered voice test. So what I'm going to do is we're going to test one ear at a time. So I'm going to get you to place your finger over your tragus like I did. And then you're just going to rapidly push it in and out, okay? Just so you can get the feel for it. And then I'm going to cover my mouth, and I'm going to say a couple words, and I'm just going to get you to repeat them back to me, okay?
Mm-hmm.
Okay. Okay, you ready? Ready. Tuesday. Armchair. Baseball. 14. Okay, good. And we'll switch ears. Okay. Ready?
Mm-hmm.
Okay. Cell phone. Monday. Purple. 16. Okay, that's awesome, and you could repeat them all back to me clearly. That's good. So now we're going to look at your nose. So from what I can see right now is it's symmetrical, it's midline, and it's proportional to the rest of your face. It's also uniform color with the rest of your face, so that's good. I don't notice any discharge or nasal flaring, so that's awesome. And now we're just going to test the patency of each nostril. So I'm just going to get you to take a finger and push it against one side of your nose and close your mouth, and then take a breath in through the opposite nostril. That sounds good. Want to do the other one for me?
I would assess for
That sounds good. Is that comfortable for you? Okay, awesome. Okay, Megan, so now we're going to look at your mouth. So we're going to start with your buccal mucosa. So I'm just going to come in here and start with you. Okay, and so you look nice and pink and moist, which is great. I'm just going to check your lower lip, your upper lip. Awesome, everything looks good there. So now while I'm here, if it's okay with you, I'm just going to look at your teeth. Okay. Awesome. They're all straight. They're clean. They're nice and white. They're free of debris. I don't notice any decay. Can I get you to just show your teeth so I can get a better look at your jaw? That looks awesome. The alignment's good. Okay, Megan, now I'm just going to take a look at your gums. I'm just going to pull down your lip here, which is good. I don't notice any bleeding or retraction or edema or lesions. I'm just going to go with this one. Check. Yeah, they're nice and firm, so that's awesome. Okay, and now I'm just going to take a look at your tongue. So I'm just going to do this.
We're just a bunch of
And
cheaters.
they're pink and even. You have raised papillae, so that's good. You can just stick it out for me. So that's good. It's nice and midline. It looks smooth. There's no tenderness or anything? No? Okay. We're just going to look at the floor of your mouth. You just put your tongue up on me. That's good. And there's no white patches or nodule or ulceration, so you're good. Okay, so now we're going to look at your palate. So I'm just going to take a look.
But now, like before, I was
Okay, that looks good. It's all nice and pink and smooth, and then the parts, the harder palate has more irregular texture, which is great. So now I'm going to look at your frenulum. So if you can just put your tongue up for me. Yeah. Good. So there's no tears or lesions there, and that just connects the floor of your mouth to your tongue. That's all. Okay, Megan, so now we're just going to take a look at your tonsils. So I'm just going to use the pen light and the tongue depressor. Okay. Okay. So they're visible, but they're not sticking out at all, and they have the appropriate like indentations and whatnot. So I would grade them at a 1+. Okay, Megan, I'm just going to look at your uvula now. So if I can get you to open your mouth and say, ah, ah. Yes, that is perfect. Everything is midline and mobility and everything's good. Okay, so now I'm going to test your gag reflex. So I'm just going to use the tongue depressor and I'm going to stick it towards the back of your mouth, okay? Okay, all right? Yeah, okay, good. I'm just going to get you to stick out your tongue. Okay, I don't notice any tremors or loss of movement, and it's not deviating to either side. Nice and midline, so that's good. Okay, Megan, now we're just going to look at your neck. So from what I can see, your head position is centered, it's midline. Your accessory muscles look symmetrical. Your head is erect and still, so that's good. And now I'm just going to start looking at your nodes, okay? I'm just going to touch your face, okay? So this is preauricular, and this is posterior auricular, this is your occipital, and then this is your submental, and your submandibular, jugular digastric, and here is your superficial cervical, and then we're moving down into the deep cervical chain, and then your posterior cervical, and then your supraclavicular. Did you notice any tenderness at any point during that? No? Okay, good. Okay, so now I'm just going to check your carotid pulse, okay? It's good. It's nice and strong. And that one also is nice and strong, so that's awesome. And now I'm just going to look at your trachea, okay? So that's awesome. It's nice and midline in the neck, and it feels equal on both sides, so that's good. Okay, and now I'm just going to do a little range of motion with you and muscle strength. So I'm going to get you to put your head forward, okay, and back. Awesome, and side to side. Okay, and then ear to shoulder, each side. Awesome. Now I'm going to get you to do some of those with a little bit of resistance, okay? So I'm going to just get you to turn against my hand. Awesome. Good. And then I'm going to get you to do a shoulder shrug on your own. Okay, and then a little shoulder shrug with resistance. Awesome. That's really good. Did you notice any tenderness or pain while you were doing that? No? Okay, awesome. And you had equal strength on all sides, so that's good. Okay, Megan, now we're going to palpate your thyroid gland. And this can be done anterior or posteriorly, so front or back, but I'm going to do anterior just so you don't have to move, okay?
That's great.
So this is normally difficult to palpate, but I'm just going to start, okay? Oh, can I get you to move your head forward and slightly to the right? And can I get you to swallow? Okay, awesome. I can't feel anything there, so that's a good sign. It's not normally palpable in adults anyway. Okay, so Megan, now I'm just going to look at your posterior chest. So from what I can tell right now, it is nice and symmetrical. It has an elliptical shape and it's sloping down at the ribs. Your scapulas are symmetrical. Your neck muscles and your trapezius muscles are developed normally, and the skin color is consistent with the rest of your body. There's no concerning marks or anything like that. So now I'm just going to palpate for expansion, symmetrical expansion. So I'm just going to put my hands down here in your T9 and T10. I'm going to slide my fingers together. I'm going to get you to take a nice deep breath in.
All right, perfect. So next I'm going to
Awesome, and they separated perfectly, so that's really good. Okay, Megan, so we're gonna check for tactile firmitus right now. So it's basically just a vibration that I can feel. So I'm gonna start, and I'm just gonna get you to say, would you like to say 99 or blue moon? Blue moon. Okay, so we're just gonna start here. Blue moon. Okay.
and then the same with the other side.
Blue moon. Okay. Blue moon.
So air passes
Blue
through the
moon.
nostril
Okay.
easily,
Blue moon.
and there's no sign
Yep.
of obstruction.
Blue moon. Okay. Blue moon. Blue moon.
So you can head it out in the middle.
Blue moon. Okay. Blue moon. All right, that's good. So the vibrations feel the same on each side, and they were slightly stronger on the right over the scapula, but that's really normal. So now we are going to palpate your spinous processes, which basically means I'm just going to feel up your spine and make sure that it's straight, okay? Yeah. Okay, so I'm just going to start up here at the top, feel the way down. That's good.
Okay, so first I'm going
Let
to
me know if you feel any pain.
the
Okay?
process. I'm just going to hold your cheek back between okay. And so it looks pink, moist, and
Go back up.
no lesions or lumps. Okay, perfect. So I'm just going to get you to close your mouth, and I'm going to inspect your teeth. Okay, so they are white.
Yes, that feels fantastic.
Space.
Nice straight line. And your right and left shoulders appear to also be equal in height and aligned with your hips. All right, Megan, now we're going to pass over all of your lung fields, okay? So we're just going to start up here.
Okay, so next I'm going to test your gag reflex. Okay, so your gag reflex is present, so that means your cranial nerves.
Okay, and those all are all resonant sounds. So now we're just going to move down to your back.
Next, I'm going to get you to stick with your tongue for me. And her tongue does not deviate to any side. Do you want it? So, that is perfect.
Just move your brow up a little bit. Out. Up. Down. And just do the same on this side.
Oh, you know what? For that, I wrote this down in order just so people I meet you.
And those lower ones are all pretty dull, so that's good. Okay, Megan, I'm going to percuss your costovertebral angle for tenderness. That basically means where you would bend over at your side, right at your 12th rib. And I'm going to do it indirectly, so I'm going to put your hand on your back and then give it a little hit. And then, so you just let me know if there's any pain or anything. You should feel a thud, though, okay?
Super
Yeah.
or deep
Any
cervical
pain?
chain.
No.
Yeah,
No?
and then
Good.
Deep cervical chain is
Again?
the one that goes all the way up.
You good? Any pain?
No, no pain.
Okay,
Might
awesome.
be a problem.
All right, Megan. So we're going to auscultate for some breath sounds, which basically just means I'm going to listen to your lungs, okay? And I'm just going to move across your back, and as I do, if you could just take a little bit of a deep breath in each one, that would be awesome. Okay.
Water when I tell you to. First, I'm going to do it
Ready?
anteriorly. So
Ready.
I'm gonna get you to lean your head forward and to the right. I'm just going to move your trachea to the side. And now I'm just going to move into it posteriorly. So you're going to have your head in the same position.
You should see my lab coat.
And
It has a whole
will displace your triggers.
It's used. Thank you. I just
Perfect. And
got
then
them for free.
again on the other side. So I should take those in. Awesome. Okay.
Shut
so
Okay, and I'm just going to move your bra here, okay?
healthy at all, and it wasn't. So everything is great there. Okay, so I step against the right. I'm trying to check the thing while I'm doing it. I'm like, what the hell? Did we do this? I don't know. I don't think so. Thyroid. Great. Okay.
Okay.
I still have
Good.
a cough. I just
Also,
got
if we,
a little short of breath, so I'll just have to see more.
that's fine.
Very good. Yeah, so everything there side by side was super even. There wasn't anything abnormal. So it was
I've
good.
worn like 10 hours of this.
Okay, Megan, so now we're going to inspect your respirations and look at the skin characteristics of your chest. So from what I can tell, your ribs are nice and symmetrical and the spaces feel pretty even. Your facial expressions don't look like you're in any pain when you're breathing or anything like that. It doesn't look like you're using any conscious effort, and your chest seems to be rising symmetrically. Can you just take a breath for me so I can see? Make sure. Yeah, we're good. No stress. And no cyanosis is present, so that's good. So your lips aren't blue or anything. And now we're going to palpate tactile premise, which basically means I'm going to put my hand on you. I'm going to get you to say 99, and then I'll feel the vibrations, okay? All right, you good? Okay. So we're just going to start right here. 99. Okay. 99. Okay. 99. 99. Move your bra a little. Yep. Okay. 99.
Do you think this is too tight?
99. Okay. And then I'm just going to go right about here. 99. 99. Perfect. That's really good. Okay, Megan. So now we're going to move on to vesicular, okay?
And then last one. And I would strongly suggest putting them on creative because it helps get the this room. It is a room. I feel secret. I did trip a little.
So I'm going to ask you a few questions first. Can you tell me your name?
Here.
That's what we're doing.
Just need to go in here. I'm sorry. That's okay. Good. And the other side. Good. That's nice and clear. Okay, so I'm just gonna go underneath it. That's all right. Yep. Okay. Good. I'm just gonna move our way down. We're almost done. And that's really good. Okay, Megan, now we're going to look at your heart. So basically I'm going to inspect your pericardium, which basically just means I'm going to just look at your chest. And from what I can see, I don't see any abnormal pulsations or lifts or heaving or anything, so that's really good. And next, I'm going to auscultate using ape to man, which basically just means I'm going to use my stethoscope and I'm going to listen to your chest sounds, okay?
Alright, so this is like
To get started, I'm going to start with the aortic, which is in the second right intercostal space, okay?
relax.
Your tray. And put it all there.
The auditory meatus opening.
Your tray. Your opening.
Did you say oracle?
Your oracle is the one.
Good. I'm going to listen to the pulmonic, which is in the second left intercostal space.
It doesn't matter.
This. Because this is what it is. It's right here. It's supposed to go right across to you.
Awesome. Now I'm going to listen to Herb's point, which is in the third intercostal space.
Do you think?
Nice and loud.
Okay, I'm gonna redo that, sorry. Okay. Because we're gonna
Okay.
position
And now I'm going to go into the tricuspid. Awesome. And one more down just to the mitral, okay?
honestly, the easiest part is yeah, because you're
Really
like
good.
words and you're gonna put it there.
Okay, so your rate and your rhythm is really good. It was nice and strong. I could hear everything really clearly. And your S2 was louder than S1 at the base, which is up here. And then your S1 was louder than S2 at the apex, which is down here. So that's normal. Great. All right, Megan, now we're going to look at your upper extremity. So we're going to start with symmetry. So I'm just going to roll your sleeves up a little bit here so I can get a good look. And I don't notice any immediate redness, no muscle atrophy or deformities. There's no swelling present. All of the bony landmarks feel good. I'm just going to give your hands a little inspection, make sure your interphalangeal joints and metacarpal phalangeal joints are good. There's no swelling, no bogginess, no tenderness. Okay, I don't notice any enlargements or anything. That's really good.
Alright, so that was good.
Now we're just going to do a little bit of range of motion and muscle strength. So we're going to start with your hands, okay? So we're going to bend the hand up at the wrist, okay? Good. Can you do on the other hand as well? And that's called hyperextension. We're going to bend the hands down at the wrist, which is palmar flexion. Then we're going to bend the fingers at the metacarpal phalangeal joints. So that one is, yeah, that one's this one and this one. So this is flexion and this is hyperextension. Good. Okay. And then we're going to do palms flat on the table. So I'm just going to get you a little surface here and I'm going to get you to turn them inward and outward. So you're just going like out and in. Just try to keep your elbows in, that's all. Awesome. Good. You got it. So, okay, perfect. Thanks. Okay. And then we're going to get you to spread your fingers apart and then make a fist. Okay. And the spread apart one is called abduction. Nice to your fists again. Good. Okay. Then we get you to touch your finger. You touch your thumb to each finger, and then the base of your pinky. That's perfect. And you burn those equally bilaterally, so that's great. Do a little range of motion of your shoulders, but first I'm just going to check and make sure you don't feel any swelling or anything. Any tenderness? No. Good. So I'm just going to put my hand here and cup your shoulder, and I'm just going to get you to do some movements with your arm. Awesome. You're not feeling any pain or anything? Okay. There's no cracking sounds or crepitation, which is great. Alright. So now we're going to do some movements. So we're going to get you to get your arms up, and that's flexion, and come back down. Awesome. I can just get you to put your arms like this. Okay. And then we're going to go up for external rotation and down for internal rotation. Awesome. And we're going to get you to put them out for abduction and in for adduction. And all those muscles, or sorry, all those movements were nice and smooth. So I would grade your muscle strength at a 5. All right, Megan, now we're going to palpate your epitrocular nodes. So I'm just going to take your hand in the handshake form. I'm going to go under right here, and I'm just going to feel for them, okay? And I can't feel anything, which is completely normal. I'm going to do it again on this side. Feel for them again. And again, I don't feel anything, so that's fine. Okay, and now we're going to palpate for your pulses. So we're going to start with brachial on this side. And that's good. It's nice and strong, even rhythm and stuff. Okay, and do radial. There we go. Nice and good.
Long,
Ulnar.
3.5 hours. Okay. Yeah, but the first hour we did nothing.
Go. It's good.
Okay, ready?
Move on to this side. Brachial.
Oh, carotid. Muscle strength.
Yeah, that one's good.
Okay, I'm good.
Radial. And ulnar.
Okay, Mike. Next thing's next. We're gonna do your carotid pulse.
Yeah,
Okay.
so they're good. Your blood's flowing. Everything should be good. All right, Megan, now we're going to inspect your abdomen. So I'm just going to look at the contour and the symmetry and the skin and stuff, okay? So I'm just going to take a look. Okay. Now it looks good. It's nice and flat. And then I'm just going to shine a light across to get a better look. And that looks pretty symmetric to me bilaterally. If you could just take a deep breath for me. Yeah, that's nice and good. Awesome. There's no bulging or any visible masses or anything like that, so that's awesome. Okay, and your umbilicus or your belly button looks good to me. It's inverted, which is good, and there's no inflammation or odd colors or anything happening there, so that's awesome. And your general overall skin appearance is good. You have a couple of moles, but that's really common on the abdomen. Okay, Megan, now we're going to auscultate your, for some bowel sounds. So I'm just going to take my stethoscope and I'm going to put it in 4 approximately locations around your belly and just have a listen, okay?
Yeah. Am I supposed to palpate too? I gotta do 99 the front too. Is going.
Everything sounds good there. Okay, and now we're going to auscultate some vascular sounds. So I'm going to use the bell of my stethoscope. So I'm just going to change the setting on mine. Okay, and I'll be listening for any bruits, but hopefully we won't hear any. Okay, we're going to start with the aorta.
If you look at the picture, right?
Okay.
So these are all vesicular.
We're going to do the left renal artery.
1, 2. You think they're all vesicular?
Okay, and right.
These are definitely vesicular.
Okay, and we're going to do the iliac artery. On the other side.
And bronchial vesicular in the back. What I'm listening here.
Okay, and then the femoral artery. Okay. And you're good. Now I'm going to percuss the 4 quadrants. I'm just going to be listening for tympani and dullness, okay? So I'm just going to be hitting my finger as I move around your stomach. Okay. Okay, and now I'm going to do some palpitation of the 4 quadrants, okay? And just let me know if there's any tenderness or anything. Okay, and there's no obvious muscle guarding or rigidity or large masses, and you didn't feel any tenderness, right? Nope. Good. All right, Megan, now we're going to look at the inguinal areas. So I'm just going to start by palpating your femoral pulse. Okay.
At least get one done. Crazy though how long it takes.
And that feels good. Okay, and then we're just going to feel for any lymph nodes. And I'm not noticing any. Okay.
Okay. I'm gonna get you to sit in the chair, and then I'm gonna say, okay, Mike.
And then I'm going to go and do the other side.
It doesn't look so.
All right, Megan, now we're going to look at your lower extremities. So I'm just looking at your legs, and from what I can see, they look nice and symmetrical. The skin condition looks really good. Your hair distribution's equal. I don't see any varicose veins present, which is fantastic. So yeah, I'm just going to take some pulses. So I'm going to start with the popliteal, which is right behind your knee. Just going to prop this up a little bit.
You don't need to answer. I'm like, oh, it looks healthy. Great. I'm good to go. I'm breathing.
Good, that's awesome. Okay, and now we're just going to turn this a little bit. I'm going to do a posterior tibial.
Yeah.
That's good. And now we're going to do dorsalis pedis, which is just on the top of your foot here.
Ready?
That's good. And I'm going to reach across here and do it on the opposite leg.
On the heart? The heart is actually really quick. You know that, right? No. It's very quick. Oh, I have no idea what that is.
Awesome. Okay, I'm just going to turn it slightly so I can get to this one. That one's good. And then back to dorsalis pedis. There we go. And there, Megan, now we're going to palpate for temperature and pretibial edema. So basically, I'm just going to feel your feet. They're not excessively warm in any way. And then for the edema, we're just going to do this and make sure that there's no pitting and like your skin comes back basically instantly. So you're fine. There's no fluid or anything present. I don't see anything up here either, so you're good on that front. And I'm just going to separate your toes and make sure you don't have any infections or cuts or anything happening. You'd like for you to keep your toes. Yeah, so you're fine. Yeah, I hope so too. All right, Megan, now we're going to look at your hips. We're going to do range of motion as well as muscle strength. So basically what I'm going to do is put my hand on your hip and get you to go through a series of motions. You're going to let me know if there's any tenderness. Hopefully there's not. It would be ideal. As well as any crepitance. So they like popping or crackling sounds. Okay? All right, so I'm just going to get you to go up with your knees straight. So this is hip flexion. Really good. You can do that by yourself, so that's great. And then we're going to do hip flexion with your knee bent. So you just get you to come up and then perfect. It's really good. Okay, and then bend your knee but with your foot on the bed. So just slide it back. That's great. So we can get you to do an internal rotation. Awesome. And an external rotation. Perfect. And just straighten back out your leg. Okay, and then I'm going to get you to do abduction, which is just swing it out straight, and then adduction and swing it right back in. That's great. And you can do all of that on your own, so your muscle strength is really good. All right, Megan, now we're just going to do a little inspection of your knees and some range of motion, okay? So based on looking at them, I don't see anything wrong with the color or anything. Do you feel any tenderness when I touch them? No. Okay, good. I don't notice any swelling or anything. I'm just going to get you to step off the bed, and we're going to do a couple of little exercises. So I'm just going to get you to bend at the knee like this, and that's flexion. And then back down is extension, and then out is hyperextension. Yeah, awesome. Can you do it on the other leg for me? Oh, perfect. Okay, and just to test your muscle strength, can I get you to do a squat? And that was perfect, so I definitely grade your muscle strength out of 5. All right, Megan, now we're going to move on to your ankles and your feet. So I'm just going to start first by palpating them and making sure that there's no tenderness or swelling. You let me know if you feel anything. I don't see any obvious deformities or carpitation or anything like that. And it aligns really nicely with the long axis of the lower leg bone, which is good. And your toes point forward and they lie flat. It's really good. Okay, so now I'm going to get you to point your toes towards the floor, which would be plantar flexion. I'm going to get you to point them up towards your nose, which is dorsiflexion. And then I'm going to get you to turn the soles of your feet out, which is eversion. Good. And then in, which is inversion. Awesome. And I'm just going to get you to flex your toes, crouch them up, and then stretch them back out. Awesome. So now we're going to do muscle strength. So I'm going to start with plantar flexion. So I'm going to get you to push against my hand, down. Yeah, good job. And the other one. Awesome. And then I'm going to do dorsiflexion. So point towards your head again. Perfect. And back up again. Awesome. And those are nice and strong. So I would grade that as a 5. All right, Megan, now we're going to do the neurological system. So we're just going to start with sensation. So we're going to do pain. But just so you know, it's not very sharp. So give it a little feel there. That's good. And then this is the dull side. Okay. So what I'm going to get you to do is close your eyes. And I'm going to touch different surfaces on your body. And you just say which one you feel, whether sharp or dull. Okay? Okay. Dull. Sharp.
Oh my gosh. Yeah, do not do that. Maybe you can do
Sharp.
that. Yeah, that's a good idea.
Dull.
No. Like, just
Sharp.
here.
Dull. Dull. Sharp.
Or maybe.
All right, that was really good. Okay, so now we're going to move on and we're going to do light touch. So I'm going to use a little cotton wisp for that so you can just feel on your hand. It's nice and soft and gentle. And I'm just going to ask that you tell me when you're being touched. Okay? Okay? Yeah.
When I asked her in lab, she was like, oh, it doesn't matter where you hear it. But she's like, yeah, but it's so cute.
Really good. So you got all those. Awesome. All right, Megan, now we're going to use vibration. So I'm just going to use this tuning fork here. I'm just going to hit it off my hand. Just feel a light vibration. When you feel that, just so you know what it's going to feel like. Okay. And then I'm just going to get you to close your eyes and you just tell me when you feel it. Okay? Okay. Yep. 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 Okay. Yep. 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 Okay. Really good. So we did your interphalangeal joints, we did your big toe, and just a couple other joints along the way. That's good. Okay. All right, Megan, now we're going to test the position sense of your finger. So I'm just going to take your hand here, and I'm going to hold your thumb. So this is up, this is down, this is side to side. Okay. I'm going to get you to close your eyes, and then just tell me which way it's going. Okay. Up, down, up, down, side. Okay, that's really good. I'm just going to do it on the other hand. Up, down, side, up, down. Good. Okay, you got it. All right, now we're going to do stereogenesis. So I'm just going to get you to close your eyes. I'm going to put a common household item in your hand, and I'm just going to get you to tell me the name, okay? Okay. Good. Go. Is that a paper clip? Okay, awesome. So you were able to properly name the objects. All right, Megan, now we're going to test cerebellar function of the upper extremities. So we're going to do RAM, which is basically rapid alternating movements. So I'm going to get you to put your hands on your knees and then flip them over and then start doing that and get progressively faster. Awesome. That's really good. So they were quick, rhythmic pace. They moved in unison. So yeah, all good. All right, now we're going to test cerebellar function of your lower extremities. So I'm just going to get you to take your heel of this foot and run it down the shin of the opposite leg. Perfect. And then can you do it from this side? Perfect. All right, Megan, we're going to look at your deep tendon reflexes now. So we're just going to start with your bicep. So I'm just going to take your arm in here. I'm going to let you rest on me and relax. I'm going to put my thumb in here on your tendon. I'm just going to strike my thumb, okay? Oh, good. Thank you. I'm just going to do the same thing on this arm. Great. Thank you. Okay, and we're going to do your bicep. So I'm just going to get your arm up here nice and relaxed and just weigh it on me. Actually, I'm going to switch arms. It's easier for me to use now than his hands.
The patient is, so you're going to work your way down, like, so you're going to do femoral,
Good.
like, the patient,
Switch
femoral,
this one.
you know, top of heel, dorsal and,
Good. Alright, and now we're going to move down to your brachial dalis. So I'm just going to hold on to your thumb here. And just let me hold the weight. I'm just going to right over there, okay? Good. This one. Good. Awesome. So now we're going to move on to your knees, so your patellar. Alright. Try not to block the camera. Good. Okay. And now we're going to move on to your Achilles. So just move it down here. Good. Swing.
Yeah.
Good. Okay.
Circumduction, right.
I'm just looking at the sheet. Got this part out.
I didn't hope you drank
Oh, the J foot thing.
You leaving?
Oh, is it the Bensky's reflex? Yeah. Okay. Oh, no, please not right now.
I gotta do my range of motion again for my extremities.
So is it Bensky's reflex? Okay. All right, Megan, now we're going to do Bensky's reflex. I'm just going to take your foot here.
Yeah. I think I'm gonna do that whole upper extremity part again.
This one.
It won't take long though, like.
Good. All right, so we're done that? All right, Megan, so we're going to do musculoskeletal now. So I'm just going to get you to walk to the end of the curtain there, turn around, and then walk back heel to toe. Really good. Now can I get you to walk on your toes to the end of the curtain? And then walk back on your heels. Awesome. That was good. Thank you. All right, Megan, so now we're going to do Romberg's test. I'm going to get you to put your feet together. And I'm going to stand here, and you're just going to close your eyes, okay? And I'll make sure you don't fall or anything. Good. Okay. So it was very minimal swaying, so you're good there. Now we're just going to do a little bit of range of motion of your spine. So I'm just going to get you to bend over at your hips and touch your toes. Awesome. Good job. And then we get you to do a lateral bend to the side. And then the other side. Good stretching. Okay. And then we get you to rotate at the waist. Awesome. And then hyperextend. Back. Awesome. So that's really good. So we're all done the musculoskeletal system. Great. All right, Megan. So we're done our physical assessment for today. How are you feeling? Great. It's good. Okay. So I didn't find anything abnormal or anything out of the ordinary, anything to be concerned about. You seem to be in great health. Thank you. You're welcome. So I hope you have a good day, and I'll let you get dressed.
Thanks.